Gluten. Gluten is a mixture of proteins found in certain grains, specifically wheat, barley, and rye. It gives dough its elasticity and helps bread maintain its shape. For people with celiac disease or gluten intolerance, ingesting gluten can cause an immune reaction that damages the small intestine. It leads to symptoms such as abdominal pain, diarrhea, and malnutrition. For these individuals, a strict gluten-free diet is necessary to manage the disease and maintain good health. In recent years, gluten-free diets have become popular even among those without celiac disease or gluten intolerance. Some people believe it can improve their overall health or help with weight loss. However, there is limited scientific evidence to support these claims, and a gluten-free diet can actually lead to nutrient deficiencies if not properly balanced. It is important to note that gluten-free does not always mean healthy, as many gluten-free products are highly processed and contain added sugars, fats, and salts. If you have concerns about gluten and your health, it is best to consult with a doctor or registered dietitian. They can help determine if a gluten-free diet is appropriate for you and provide guidance on how to ensure adequate nutrient intake while avoiding gluten. Celiac disease is an autoimmune disorder that affects the small intestine. It is triggered by the consumption of gluten, a protein found in wheat, barley, and rye. When a person with celiac disease ingests gluten, their immune system attacks the small intestine, causing damage to the villi. These finger-like projections line the small intestine and play a crucial role in the absorption of nutrients from food. Damage to the villi leads to malabsorption of nutrients, which can result in a range of symptoms. They include abdominal pain, bloating, diarrhea, constipation, and malnutrition. Over time, untreated celiac disease can also lead to serious health complications such as osteoporosis, anemia, and even cancer. Diagnosis of celiac disease can be challenging as symptoms are often nonspecific and can mimic those of other conditions. However, a combination of blood tests, biopsy, and genetic testing can help confirm a diagnosis. The only treatment for celiac disease is a strict gluten-free diet. This means avoiding all products that contain gluten, including bread, pasta, cakes, and beer. A gluten-free diet must be followed for life to manage the disease and prevent further damage to the small intestine. It is important for individuals with celiac disease to work closely with a registered dietitian to ensure they are getting adequate nutrients and avoiding hidden sources of gluten in their diet. With proper management, most people with celiac disease can lead healthy, normal lives. The estimated incidence of celiac disease is about 1 in 100 people worldwide. There are two incidence peaks for age of onset, 1 to 5 years and 30 to 40 years. However, the exact prevalence may vary depending on various factors such as geographical location, ethnicity, and age. Celiac disease is more prevalent in some geographical locations compared to others. In general, it is most common in people of European descent, particularly those of Northern European ancestry. The highest prevalence has been reported in North America, Europe, and Australia. However, it has also been found to occur in people of other ethnic backgrounds, including those in the Middle East, Africa, and Asia. Symptoms of celiac disease. Celiac disease can cause a wide range of symptoms, which can vary greatly from person to person. Gastrointestinal symptoms. These are the most common symptoms and include abdominal pain, bloating, diarrhea, constipation, and nausea. Malabsorption. People with celiac disease may experience malnutrition, weight loss, and fatigue due to poor absorption of nutrients from food. Skin rashes. Some people with celiac disease develop skin rashes, such as dermatitis herpetiformis. Anemia. A lack of iron and other nutrients absorbed from food can cause anemia. Neurological symptoms. Some people with celiac disease may experience tingling in the hands and feet, depression, and seizures. Mouth ulcers. People with celiac disease may experience mouth ulcers. Osteoporosis. People with celiac disease are at risk of developing osteoporosis due to poor calcium and vitamin D absorption. Infertility and miscarriage. Some people with celiac disease may experience infertility or recurrent miscarriage. Some people with celiac disease may have no symptoms at all. What are the symptoms of celiac disease in children? The symptoms of celiac disease in children can vary greatly and can be similar to other digestive disorders. Gastrointestinal symptoms: diarrhea, constipation, abdominal pain, bloating, and nausea are common symptoms in children with celiac disease. Failure to thrive. Children with celiac disease may experience stunted growth, weight loss, and delayed puberty due to malnutrition. Skin rashes. Some children with celiac disease develop skin rashes, such as dermatitis herpetiformis. Anemia. Children with celiac disease may experience anemia due to poor absorption of iron and other nutrients. Mouth ulcers. Some children with celiac disease may experience mouth ulcers. Behavior changes. Children with celiac disease may experience irritability, fatigue, and depression. Delayed growth. Children with celiac disease may experience delayed growth and developmental milestones. What are the causes to celiac disease? The exact cause of celiac disease is not fully understood, but it is believed to be a combination of genetic and environmental factors. Genetics. Celiac disease is a genetic disorder, and having a family history of the condition increases your risk of developing it. Certain genetic markers, such as HLA-DQ2 and HLA-DQ8, are strongly associated with celiac disease. Gluten. Gluten is a protein found in wheat, barley, and rye. It is the main trigger for celiac disease and causes an immune response in the gut of people with the condition. Other environmental factors that may contribute to the development of celiac disease include gut infections, pregnancy, surgery, and severe emotional stress. The role of villi in celiac disease. The villi are small finger-like projections in the small intestine that play an important role in the digestive process. They help to absorb nutrients from food into the bloodstream. In people with celiac disease, exposure to gluten in the diet causes an immune response that damages the villi. When the villi are damaged, they become flattened and less effective at absorbing nutrients. This can lead to malabsorption, malnutrition, and a wide range of symptoms. Over time, repeated damage to the villi can lead to permanent damage and a decrease in the ability to absorb nutrients. It's important to note that following a gluten-free diet can help to heal the villi and improve the ability to absorb nutrients. However, it may take several months or even years for the villi to fully recover. And some people may experience persistent damage even with a strict gluten-free diet. In these cases, ongoing monitoring and management of the condition may be necessary to maintain good health. Diagnosis of celiac disease. Diagnosis of celiac disease involves a combination of clinical evaluation, blood tests, and a biopsy of the small intestine. The following are the steps involved in the diagnosis of celiac disease. Blood tests. Blood tests are used to check for antibodies that are associated with celiac disease, including tissue transglutaminase, TTG, antibodies, endomysial, EMA, antibodies, and deaminated gliadin peptide, DGP, antibodies. A positive result on these tests may indicate celiac disease, but a biopsy is still needed to confirm the diagnosis. Endoscopy and biopsy. An endoscopy is a procedure in which a flexible tube with a camera on the end is inserted into the small intestine to inspect the tissue. During the procedure, a small sample of tissue, biopsy, is taken and examined under a microscope to look for damage to the villi. A biopsy is necessary to confirm the diagnosis of celiac disease and to determine the severity of the damage. Duodenal biopsy. A duodenal biopsy involves taking a small sample of tissue from the small intestine to examine for damage to the villi. The biopsy is typically done during an endoscopy. Jejunal biopsy. A jejunal biopsy involves taking a sample of tissue from the jejunum, which is the part of the small intestine closest to the stomach. This biopsy is less commonly performed but can provide additional information about the extent of villus damage. HLA testing. HLA, human leukocyte antigen, testing is a blood test that can check for genetic markers that are associated with celiac disease. A positive result on this test increases the likelihood of having celiac disease, but a biopsy is still needed to confirm the diagnosis. It's important to note that a definitive diagnosis of celiac disease can only be made after a biopsy of the small intestine has been performed. The biopsy allows for the evaluation of the extent of villus damage, which is necessary for the diagnosis of celiac disease. Treatment of celiac disease. The main treatment for celiac disease is a strict gluten-free diet. Diet. This involves eliminating all sources of gluten from the diet, including wheat, barley, and rye. The goal of the gluten-free diet is to allow the small intestine to heal and prevent further damage to the villi. A strict gluten-free diet can be challenging, as gluten is found in many common foods, including bread, pasta, cereal, and baked goods. People with celiac disease must also be cautious of hidden sources of gluten, such as soy sauce, processed meats, and prescription medications. In addition to following a strict gluten-free diet, the following are additional treatments for celiac disease. Vitamin and mineral supplementation. People with celiac disease may need to take supplements of vitamins and minerals, such as iron, calcium, and vitamin D, to correct deficiencies that can occur with the disease. Medical nutrition therapy. Medical nutrition therapy can help people with celiac disease learn about the gluten-free diet and find ways to meet their nutritional needs. Medications. Some people with celiac disease may benefit from medications, such as antacids, to relieve symptoms and manage complications. In severe cases of celiac disease, treatment may involve additional interventions, such as intravenous nutrition or surgery. Intravenous nutrition may be necessary when oral nutrition is not sufficient to maintain adequate nutrition. Surgery may be considered in cases of severe malnutrition, intractable symptoms, or in cases where the small intestine has become obstructed. It's important to note that following a strict gluten-free diet is the cornerstone of treatment for celiac disease, and it is essential for managing the symptoms and preventing long-term complications. Ongoing monitoring and management of the condition may be necessary to maintain good health. Prognosis for celiac disease. The prognosis for celiac disease is generally good with proper treatment and adherence to a strict gluten-free diet. With a gluten-free diet, the small intestine can usually heal and return to normal function within several months to 2 years. The vast majority of people with celiac disease experience significant improvement in their symptoms, such as abdominal pain, bloating, diarrhea, and weight loss. However, if celiac disease is left untreated, it can lead to serious long-term health problems, such as malnutrition, osteoporosis, infertility, and an increased risk of certain cancers. Therefore, it is important for individuals with celiac disease to strictly follow a gluten-free diet and work closely with their healthcare provider to monitor their condition and prevent complications. It's worth noting that while a gluten-free diet can help manage celiac disease, it is not a cure. People with celiac disease must continue to avoid gluten for the rest of their lives in order to prevent symptoms and long-term complications. Prevention of celiac disease. Celiac disease is an autoimmune disorder that affects the small intestine and causes damage to the lining. When gluten, a protein found in wheat, barley, and rye, is consumed, the following steps can help prevent or manage the symptoms of celiac disease. Avoid gluten. The most important step in managing celiac disease is to avoid gluten completely. This means eliminating all food and drinks that contain gluten from your diet. Read food labels. Make sure to read food labels carefully to identify any hidden sources of gluten. Some common sources of gluten include bread, pasta, cereal, and baked goods. Eat a balanced diet. Make sure to eat a balanced diet that includes a variety of foods to ensure that you are getting all the nutrients your body needs. This may include eating more fruits, vegetables, and gluten-free grains like rice and corn. Choose gluten-free products. There are now many gluten-free products available in the market, such as gluten-free bread, pasta, and crackers. These products are safe for people with celiac disease to consume. Ask about ingredients. When eating out, always ask the server or chef about the ingredients in the dishes you are considering. Some sauces and seasonings may contain gluten, so it is important to ask. Use separate cooking utensils, if you live with someone who is not on a gluten-free diet. It is important to use separate cooking utensils and cutting boards to prevent cross-contamination. It is important to work with a healthcare provider, such as a gastroenterologist, to monitor your condition and ensure that you are getting the right nutrients. By following these steps, people with celiac disease can effectively manage their condition and prevent further damage to their small intestine.